Okay, so I'm at the doctor's appointment. My mom's got me a wheelchair, freaking game saver. They pull me to the back. They want to undo the splint that the ED had put on a day and a half, 2 days prior, so that they can take their own x-rays in office. I was nervous and scared. To cut off the splint wasn't bad, but I had some sensitivity. Like it felt like if you had rug burn or an abrasion to your skin. So as they were cutting away the splint with scissors, if those scissors got near that place, I mean, it was just super uber sensitive. It was just terrible. But anyway, made it through that. Went to the X-ray, got on the X-ray, and whatnot. You know, X-ray was kind of hard because remember my foot was displaced, so trying to move my foot, it just felt like it was doing this. It just felt like yes, it was upright, but it felt like I couldn't control it, and so it was kind of hard to do the X-rays. But anyway, they got the X-rays. They then just because the amount of pain that occurred, they then pretty quickly put me back into their own splint that the office put on me. I will say that at the moments of times where I needed to dangle my leg and I couldn't keep my leg elevated, that dangle is something vicious. Do y'all hear me? Even I am, where am I? I'm 2 weeks out from injury, 1 week post-op. Dangling is just, the sensation is wild. It just feels like all the blood is rushing down to my foot when I have to dangle. Because primarily I do try to keep my foot elevated for the most part, but that dangling is something else. Okay, it's just a feeling I just can't describe. But anyway, so they re-put me back in the office splint, and the doctor, talks to me. He says, yeah, I think you're gonna need, definitely gonna need surgery. You've got 3 fractures. Um, I need to get a CT scan just to be sure, but yeah, you're gonna definitely need surgery, and we can do your surgery this week. So he was telling me either Thursday or Friday. Now, all his staff, very nice, very knowledgeable, but let me tell you, this office runs like a well-oiled machine. So my next video is going to be about how this office runs like a well-oiled machine. So I'm gonna kind of take a break in my history and just kind of give my critique on this particular office. So that's the next thing.